Okay, we are rolling. I apologize. Holy cow, technology, not my forte. I'm not sure what happened on this end. I'm going to be multitasking, letting people in. So hope this works out okay for all of us. Today is Daniel's downloads. Where are we in? May 2023. I'm trying to close it out. There we go. So last time, thank you for your patience, everyone, again. And we are up and running. Last time we talked a little bit, we're just do a quick review because this is going to help us into the products that we're going to talk about today. We talked about our ISO certification. And so I showed you the step ladder of quality of companies out there and what manufacturing companies do. As I mentioned, I was not going to sit here and I will not badmouth anybody, but I want you to be aware of what the industry looks like. I'm in New Mexico, as I mentioned before. And Tuesday night, I was up in Santa Fe. Wednesday night, I was in Albuquerque lecturing live lectures. And we were talking about this ISO certification and what companies are doing, especially during COVID times, supply and demand, and how that shifted. And I wanted to share with you again, because many new people on here today, that Biotics Research has an ISO certified laboratory. So we've always had a laboratory, but now this certification gives us more credentialing from in the manufacturing world. So as I've talked about before, anytime we bring an ingredient into our facility, it goes into the laboratory. We never rely on the certificate of analysis to utilize the product. It always goes into our lab before it ever goes to production. So I wanted to share this little chart with you because many companies, and this is, by the way, a list of what's happening in the professional industry, meaning products that you are allowed to most likely carry that health food stores and Costco and Walgreens are not carrying. This is our industry. And there are companies that just private label, companies that use contract manufacturers, so they don't have the quality control, quality assurance. So it's just something to ask your suppliers about and to be aware of. But our ISO certification, we get inspected by the pharmaceutical division of the FDA as well in our manufacturing processes. So it's, again, assuring you that with what's going on in the world, that you're getting a quality product. I mentioned yesterday, when we throw some of our herbs, I'll give you an example of St. John's wort, into our HPLC, we are finding this artificially spiked with quercetin, and the other flavonoids that are the active components are not even there. So these are things we're finding, and these are things that we reject that material because we want the active flavonoids of St. John's to be there. So last time we talked about thyroid, and we have our suite of glandular products. So today's talk is on natural support for hormone replacement therapy. This kind of fits that category. I don't want you to think that we're just talking testosterone and estrogen today, but that will be a big part of the conversation. But I wanted to review our thyroid suite of GTA, GTA Forte, and GTA Forte 2. After I did that presentation, there were a lot of great questions of, well, where to implement, how to implement. So we're going to go over a couple slides to review that. So thyroid, GTA contains 5 milligrams of whole porcine glandular extract. An addition of selenium and rubidium aids in the conversion of T4 to T3. Okay, so it's just aiding in that conversion. We have seen, I can tell you that if you have an elevated TSH, remember last time we talked about, I don't recommend using these products if you don't have a laboratory panel, okay? So a TSH, a T4, T3. So aids in the conversion of T4 to T3. There's antioxidants in there to reduce the free radical inflammation and protect the tablet prolonging shelf life. Now we're going to jump down to GTA Forte 2. When the TSH is over 10, people were asking, where do you apply this product, Daniel? TSH over 10, GTA Forte 2 is 20 milligrams of glandular extract with the appropriate cofactors. Each capsule of GTA Forte 2, I'm going to say this here, is like a third a grain of thyroid. So the use of GTA and Metastim balanced 23 out of 25 patients with abnormally high TSH. All the years I've done this, I've seen this combination very effective with elevated TSH or true hypothyroid cases. We talked about Metastim last time. A review on Metastim has the conversion factors necessary to convert T4 to T3. Let me say that again, because this is big in our industry. The patient has come to you and says, my primary care says I'm totally fine. It's all in my head. My lab looks great, but they feel hypothyroid. They feel like junk. Metastim has the conversion factors necessary to convert T4 to T3. You'll see this a lot, that maybe their TSH is actually okay on prescription thyroid, but they're not converting T4 to T3 well. And so you have an elevated above the midline of the lab range T4 and a below the midline of the lab range of T3. They're not making a good conversion. When I used to work for the osteopath at Complete Health Services years ago, this was the product that Dr. J. Allen Robertson would recommend when somebody was on birth control, because we know that inhibits T4 to T3 conversion. Just one example of a places to apply this. It's very effective for patients who are already on prescription thyroid, but not feeling the results they're looking for. Before we up their medication, or before we up their amount of GTA or GTA Forte 2, look at the conversion factor. So this product, as I noted, is very effective for the patient who's no longer experiencing the optimal results from the prescription. So it fits the wheelhouse of hormone replacement therapy because at times I like to use the naturals when I can. I'm a big fan of glandulars, and you're going to see why. Glandular therapy concept. This, to me, is the true hormone analogs. You know, it's old school nutrition. Some of you aren't overly comfortable with it. I want to help you get more comfortable with utilizing it. So pure hormones, I love the statement. When I've done this talk on just a whole talk on glandular therapy, this is a perfect statement. Pure hormones are to glandular therapy as pure sugar is to nutritional therapy. It's just one component. Now, am I anti-thyroid, anti-hormone? Absolutely not. Absolutely not. But I'm offering you ideas to either use an adjunctive therapy or as a combination to estrogen, testosterone, thyroid, things of that nature. Sugar supplies one necessary nutrient, but in a form that is unnecessarily refined and concentrated. So glandulars have all the peptides and all the cofactors for hormonal balance. You know, there's not measurable hormone in it, but you are getting all those peptides. Everybody's big into peptide therapy. This is kind of the original peptide therapy. But let me assure or reinforce how we obtain and how these glandulars are processed. I talked about this last night here in Albuquerque. I was at Biotics a few months ago and getting a tour of the manufacturing facility. And in one of the rooms, they are hand defatting the material, the full organ right there, hand defatting the material. Now, what makes that different? Most of the other sources of glandular therapy out there is coming in vats of dehydrated material from animals they have no clue of the health of. We contract with certain suppliers. We can trace our material back to the farm, back to the animal. And in many cases, we're using neonatal material that doesn't have lipofuscin, oxidation, overly fatty, hasn't been exposed to the environment that long. So you're getting very clean material. And then the hand defatting, we're not using chemicals to defat. So in 1970s, large hormones, enzymes, and peptides can be absorbed intact. This was found out in the 70s. Yet glandular therapy, well, it goes back, you know, what were people, hunter and gatherers, eating? They were eating the organs at times. So in the 70s, we discovered that the large hormones in these glandulars, the enzymes and the peptides, they can be absorbed. That's the beauty. I've always talked about the innate ability of the body to take what it needs in and utilize. So extensive dye and radioactive tagging show that enzymes like bromelain and chymotrypsin cross the GI intact. A large enzyme, but they do cross the GI intact. So stained and radioactive tagged cells show accumulation in the target cell. Again, the beautiful innate ability of the body. So remember last time we talked about the importance of adrenal. We have the adrenal pituitary thyroid axis, right? So we talked about thyroid, but I've also mentioned that I felt, and from my mentors that have trained me well, that you will never fix a thyroid if you have a totally hypoadrenic, exhausted patient because of that feedback loop, the hormonal feedback loop. So when you put a radioactive isotope on adrenal tissue, you will find it in the targeted tissue of the adrenal gland, feeding that gland, waking it up. Many of us are comfortable with adrenal tissue, cytosine AD, ADB5. And when people take it, they feel better, they wake up. So that's true glandular therapy. That is an analog to hormonal therapy. So traumatized glands also show more rapid uptake than normal glands. A damaged thyroid cell shows accelerated regeneration when treated with thyroid cells. So you have the citations down here. But again, GTA is a glandular, not detectable hormone levels, but all the peptides, all the cofactors for that gland to function better. That's why you may have prescription thyroid, you have the T4, T3, but when you use the glandular component, I've seen the customers like you out there getting very, very good results with true hypothyroid cases. Now, that's a hard thing to publish because we know there are organizations out there that would really try to squelch that concept. But I assure you, with the history I have with biotics research, with the territory, you see me in Albuquerque right now, the territory that I cover and the feedback that I get from the customers, it is a very viable way to utilize and thyroid products for thyroid cases. So here's just a few to consider, because some of you aren't familiar with these. Everything in the catalog called cytosine is some form of a glandular, okay? So aside from that, I know we get our names a little confusing. GTA, GTA Forte, GTA Forte 2 is thyroid glandular, okay? But cytosines are, you're going to see it here, adrenal, female, this is a combination of glandulars, orchic tissue, testicular tissue, this is for men, it's a combination product, and then cytosine PT, HPT, pituitary hypothalamus. There are other glandulars, but I just want to talk about these and kind of focus on these. We talked about adrenal. You can really wake somebody up who's just exhausted. We had that lecture a couple months ago. The orchic tissue for men. Not to be blunt, but I will be blunt. It wakes up the testes. You know, I've had men practitioners who had low sperm counts and, you know, were trying to start a family and put them on the cytosine orchic, and you will wake things up. So very effective therapies. These are true hormonal analogs to consider adding into your practice. Even if you're doing other hormonal therapy, I think you'll find that you'll get better results. So let's talk about testosterone as an individual. B Vital provides naturally occurring precursors to naturally increase testosterone. It has elk antler, which has been used in China for thousands of years to increase virility. You have Peruvian maca, which is an adaptogenic substance that will aid in optimizing androgen levels. So I generally recommend 2 BID for a month and adjust or retest as needed. B Vital is very effective for men and women, by the way. You know, testosterone, I know many of you know this, but, you know, it's not just a male hormone and it's not just about libido. It's about better sleep. It's about less anxiety. And for women, you know, when I worked in the clinic days and they came in fatigued, we looked at thyroid and testosterone, because a little bit of testosterone goes a long ways for energy and focus and better sleep. So here's B Vital, natural testosterone augmentation, consistent testosterone elevation. I'll show you that. Here's the two main nutrients. So Peruvian maca, regulation of sexual dysfunction. It has neuroprotective effects, memory enhancement. It's an antidepressant. But let me share with you, there was a naturopath up in the Northwest years ago, did an amazing study with Peruvian maca and showed it helped regulate pituitary hormone output. And there were really good studies with hot flashes. So one of my customers in Arizona uses a lot of B Vital to reduce hot flashes. So not only is it a testosterone enhancing, libido enhancing product, but the maca, as Dr. Hudson in the Northwest pointed out in her study, was a pituitary hormone regulator. Here's a little study, a preliminary study of men, small study, ages 45 to 55, found that supplementation with B Vital from Biotics Research for 30 days increased salivary free testosterone in 100% of the subjects. Now, was it as big of a jump as you're going to get if somebody's using a testosterone cream or a testosterone pellet or a testosterone injection? No. But generally, and I'm not trying to be disrespectful to the prescribers out there, it's not my first line choice. There are so many factors in men and women of why low testosterone. One, adrenal dysfunction. Two, our absolutely toxic world. Three, our diet. I had a brilliant MD up in Flagstaff years ago, would not prescribe testosterone to men or women until they got on enough fats. And I mean, this doctor would show up at a conference eating a stick of butter during the conference. That's what she was recommending for all of her patients, to get good fats in our body, good cholesterol, to help produce steroid hormones. I saw a study, years ago, brilliant naturopath down in Tucson, shared this information with me that came from the U of A, University of Arizona, that cholesterol below 150, you could not produce enough testosterone to feel healthy. Now, you see these commercials, take your statin drug, let's lower your cholesterol. And then the next commercial is, let's give you some testosterone, because they've lowered your cholesterol so low that you can't produce it effectively. So things to consider when you're talking to your patients, look at their cholesterol level. Are they on a statin drug? Those kind of things. And the things that we talked about that absolutely reduce these levels. All right, I'm going to talk about a product that many of you may not be familiar with. And I think too many of us are quiet about it. I think, meaning Biotics Research, that we don't talk about this product enough. So Gaminol Forte is a precursor to growth hormone, but we're going to give you all the details of how to utilize this product. So Gaminol Forte in 8 out of 10 women were shown to have their growth hormone significantly increased in an 8-week period, 2 to 4 tablets 3 times a day. Consider using Gaminol Forte with any hormone replacement therapy. And I'm going to show you why. Here's the big power slide. I know it's a lot of words, but I really want to read it to you. And I will send out the more details on this product. There's a really wonderful piece of literature we have that explains Gaminol Forte, which is gamma oryzanol, is a naturally occurring mixture of plant sterols and free transferulic acid esters derived from rice bran. Research indicates that gamma oryzanol has a number of functional effects, but here we go. It is best known being that it promotes the increase in lean muscle mass and enhances endorphin release. The sterol components of gamma oryzanol have noted effects on testosterone, estrogen, progesterone, and DHEA. That is a big statement right there. That's why this is a product to consider when you're doing natural hormone therapy. It has been known to provide support for those having hormonal fluctuations associated with menopause, increases human growth hormone activity as well. So candidates, athletes, fitness enthusiasts because of the growth hormone aspect. The study was done. It does raise IGF-1. Also, when low growth hormone is there, you can have immune dysfunction. So there's a family history of immune dysfunction. Look at growth hormone levels. This is not like taking steroids, by the way, and you'll see that in the literature. Someone looking for enhanced cognition because of the effectiveness of the boost in growth hormone. And as I mentioned, using it in hormone replacement therapy. All right, let's dive into a few products that we've had in our repertoire for a little while, but many of you may not be aware of it overly or haven't truly applied these. I will tell you this, we are starting to see wonderful, wonderful results. I have great practitioners in these two states that are giving phenomenal feedback on these two products. So these two products were developed by Lindsay Berkson. Dr. Berkson, kind of considered the hormone queen in the industry right now, speaks at all the big conferences, has written 21 books on hormone therapy. And so she came to us and said, would you make these for me? One is receptor detox. The other one is called hormone balance and protect. So we're going to improve hormone receptor functionality, and we're going to protect and maintain balance, bioavailability, and safety of the hormones. So why is this an issue? Because we have competitive inhibition. We have all these toxins going to the receptor site, blocking the hormone from attaching properly. Vulnerable aging population, the receptor sites are not actively involved. Receptor dysfunction with decreased signaling and hormone dysregulation. We don't have their hormones at right levels. So their testosterone may be so low, what did we talk about earlier? Low cholesterol, not enough testosterone, things of that nature. So they're not even getting enough to the receptor site. But we want to clean up the receptor sites so these hormones can attach. Now, please, we're not just talking about testosterone. We're not just talking about estrogen. I'll show you those slides. But here's what's in receptor detox. Niacin B6, calcium D-glucarate for glucuronidation, your phase 2 detoxification pathway of especially estrogen. A little bit of iodine, selenium as an antioxidant, and then your cilantro, parsley, magnesium, and milk thistle. I'll show you those. So these here, the iodine, zinc, magnesium, selenium, they normalize responsiveness after receptor protection. So they normalize responsiveness of the receptor site and offer receptor protection. It's important in estrogen metabolism and regulation. Everybody asks about this, about sex hormone binding globulin. So when you have better receptor site function, you're going to have a, excuse me, ideally a lower sex hormone binding globulin. Protects against the buildup of endocrine disrupting halides at the receptor. So these chlorides, these fluorides are not coming in here and blocking. The cilantro and parsley are naturally chelating agents, moves toxic endocrine disrupting chemicals, safely eliminated through the kidneys. So that's why these were added in there. It's a detoxing factor to get rid of these toxins. And then the milk thistle is to modulate the estrogen receptor, selectively binds to estrogen receptor site beta, and protects estrogen sensitivity tissues. So again, we're all familiar with detoxification. This is just added into this package specifically for the receptor sites. So what are you getting out of receptor detox? So it's not a hormone analog, but I really wanted to talk about these because of the response we're seeing. If you're doing hormone replacement therapy, you are going to get a better response with your patient with their hormone replacement therapy. Meaning, I have practitioners in these two states that if they're prescribing testosterone, progesterone, or estrogen, they're adding this into the repertoire as part of the mandatory program. So you clear off competitive inhibitors off the receptor site. You allow the hormones to bind effectively to their appropriate receptors, and you optimize the receptor functionality. The other product is called Hormone Balance and Protect. So Hormone Balance and Protect is designed to make the hormones last longer in the system without as big of curves. So performs complementary with natural hormone and hormonal therapy. So definitely a product you can utilize, again, if you are prescribing hormones. But also a product that can be used if they're not on hormonal therapy for the reasons we're going to talk about. It offers hormone protection while achieving balance, keyword balance. Optimizes bioavailability, supports the hormone metabolism. Just take a note on this slide about the PABA. This is the one that really excited me when Dr. Berkson presented to us. PABA, which is high in this product, potentiates or increases the action of cortisol, estrogen, testosterone, and DHEA. So what does it do? It's extending the half-life of the hormone, which then is in turn is balancing and protecting the impact. So you're getting a longer even keel hormonal, not such a flux. Like some of the practitioners out here will prescribe an injection of testosterone on a Friday once a week, and then they taper off. This won't taper off as fast. Okay, so they're going to get a better hormonal balance. Even through a cycle for a female, it's going to be a better hormone balance, a more level hormone experience resulting in better compliance, because you're prescribing hormones for these people. I hear it from people. I don't want to use the creams. It's kind of a pain, or I don't want to inject twice a week. It's a little too much. You can get by with less. It's what we're seeing. You can buy with less and a better response. And that makes people feel better. And they're going to be way more compliant with these products. So more than estrogen, the beneficial to multiple hormone receptors. Remember I said earlier, this is not just about estrogen, progesterone, or testosterone. This is about thyroid hormone. Remember what we talked about in the beginning is the GTAs and the thyroid products and the T4 to T3 conversion product Metastim. This product will help open up the receptor sites for thyroid. Insulin as well. So our insulin dysregulation patients are people that are doing the peptides for weight loss. This is only going to add to the benefit of these programs. So what's hormone balance and protect? The highlights on that one. Promotes hormone balance by enhancing the bioavailability of the hormone action. Okay. And it protects and helps maintain balance and supports receptor functionality on all of your hormones. So don't just think about estrogen, again, or just testosterone. Think about all those that we just listed down. Okay, I'm going to back up one slide. You can't see that slide yet. So I'm going to look at the chat box in a minute. I'm not sure if I have Jacqueline online or not, so I will go through it. The raffle quiz. First 3 to answer in the chat box get a bottle of the Gaminol Forte. Again, I apologize for the technology issues early on. I hope plenty of you got something out of this. And I wanted to be respectful of your time at the same time. So first 3 to answer in the chat box get a bottle of Gaminol Forte. Which thyroid product is recommended to help T4 to T3 conversion? GTA, Metastim, or Cytozyme PTHPT? I'm going to look in the chat box. First 3 get it. Okay, I'm going to name it out so I'm fair. Carla, you got it. Dr. Benson. Oh my gosh, this Dr. Wilcox. And I didn't tell him the question, by the way. He just happened to, he's down the hall listening. And he won. I'll have to ship him one. So thank you, everybody, for hopping on and sticking with me. I'm going to stop the recording in a minute. Let's just talk about, oh, yes. Thursday, June 22nd is the next class on longevity. What gets us there in a healthy way? It'll be a review of the class we had in Arizona last Saturday, May 20th, just a week ago, less than a week ago, by Dr. Court Vreeland on the science of longevity. So many of you couldn't make the course, or the ones that did. It's always good to refresh because we go to these long classes and then often the book goes on the shelf because we just don't have the time to review. So I'm going to allow that time with a short review in a, I know, 35-minute window. But some of the silver bullets that we walked away with from Dr. Vreeland's amazing class, he's a brilliant speaker. I'm actually trying to get him onto this class to really give his information. Those of you that have any questions, you have my cell phone here at 602-690-9636. And you have my email here, dbenning@bioticsresearch.com. I'm going to stop the recording, but then I will answer the questions, okay?